In this video, you will learn about 10 critical mistakes people make with onions. Mistakes they often do not realize can lead to serious consequences. Onions can act as a remedy, but they can also become a serious threat if used improperly. Watch until the end to avoid dangerous outcomes and protect your health. This video is going to be incredibly informative and helpful. If you want to take control of your health like a pro, give it a like, and let's get started. Mistake 1. Eating onions that still contain pesticide residue. At first glance, onions may seem like a safe food, familiar, common, and always welcome at the table. But few people realize that beneath their ordinary appearance, there may be a serious hidden danger. Most onions sold in stores are grown on an industrial scale, where they are treated with aggressive chemicals such as pesticides, herbicides, and fungicides. These substances are meant to protect crops from pests and diseases, but they often remain on the surface of the vegetables and sometimes even penetrate into their internal structure. When someone eats onions that have not been properly cleaned, especially if eaten raw, they may be ingesting small doses of toxins along with the food. Even in minimal amounts, these toxins accumulate in the body over time. They tend to build up in the liver, intestines, and stomach lining, leading to chronic inflammation, cell mutations, and the potential development of cancerous tumors. Children, older adults, and people with weakened immune systems are especially vulnerable. For them, even tiny traces of pesticides can lead to severe health issues. To protect yourself and your loved ones, experts strongly recommend choosing organic onions that are grown without synthetic chemicals. If that is not an option, it is essential to wash onions thoroughly under running water. Even better, peel off the outer layers of the skin where the highest concentration of toxins tends to be. This simple habit of rinsing and cleaning vegetables before eating them can become an invisible shield that helps guard you against serious health problems in the future. Mistake 2. Overindulging in fried onions. Fried onions have become a staple in many kitchens. Their tempting aroma, golden crisp texture, and rich flavor make them a favorite addition to a variety of dishes. However, behind this culinary appeal lies a serious health risk that many people are not even aware of. When onions are fried at high temperatures, complex chemical reactions take place. One of the byproducts is acrylamide, a dangerous carcinogen that damages cells, disrupts their structure, and increases the risk of developing cancerous tumors. The esophagus, pancreas, and lungs are especially vulnerable to its effects. Scientists have long established a connection between the regular consumption of heavily fried foods and a higher risk of strokes and heart attacks. Acrylamide not only contributes to tumor development, but it also damages the blood vessel walls, leading to inflammation, narrowed arteries, and impaired circulation. Many people who later face serious illnesses often start out with a seemingly harmless habit of enjoying crispy fried foods. Over time, the buildup of carcinogens can trigger profound changes in the body, changes that may be difficult or even impossible to reverse, even with medical help. This is why health experts recommend switching to safer cooking methods such as braising, baking, or steaming. When cooked at lower temperatures, onions retain almost all of their beneficial components, including vitamins, antioxidants, and fiber, without turning into a source of toxic substances. Changing your cooking habits might be the very decision that helps preserve your health and your life in the long run. Mistake 3. Combining onions with heavy foods. Onions by themselves are powerful stimulants for digestion. Their active compounds help increase the production of stomach acid, boost appetite, and speed up metabolism. However, when onions are eaten together with heavy foods such as fatty meats, fried dishes, legumes, or dairy products, they can become a real trigger for digestive problems. This combination places a double strain on the stomach and intestines. On one side, heavy foods take a long time to digest, leading to stagnation and fermentation. On the other side, onions stimulate extra secretion of digestive enzymes and acid. As a result, a person may experience excessive gas, bloating, heaviness, heartburn, and even cramps. For individuals with sensitive digestive systems or a tendency toward irritable bowel syndrome, such combinations can lead to serious flare-ups, diarrhea, constipation, abdominal pain, and inflammation. A common mistake is adding a large amount of raw onion to fatty mayonnaise-based salads or pairing it with fried bean dishes. In these cases, even someone with a healthy digestive system may feel discomfort, while those with chronic gastrointestinal issues risk triggering a significant worsening of symptoms. To avoid these unpleasant outcomes, doctors recommend eating onions with lighter vegetable-based meals, steamed, raw, or roasted. In this form, onions deliver their full health benefits, supporting digestion and strengthening the immune system without putting your health at risk. Mistake 4. Overeating onions when dealing with chronic stomach conditions. Many people see onions as a universal health booster, but for those with chronic stomach issues, onions can actually become a serious problem. In conditions such as gastritis, peptic ulcers, or gastroesophageal reflux disease, GERD, the lining of the stomach and esophagus is already inflamed and weakened. It struggles to cope with regular digestive demands, let alone additional harsh irritants. Raw onions contain a high concentration of essential oils and sulfur compounds that sharply increase the production of gastric juices and stimulate the release of hydrochloric acid. When this type of onion comes into contact with an already inflamed stomach lining, it is like adding fuel to the fire, causing further irritation, burning sensations, pain, heaviness, and heartburn. In people with ulcers, it may even lead to internal bleeding, a serious condition that requires immediate medical attention. Reflux should not be overlooked either. In patients with GERD, onions can trigger acid to flow back into the esophagus, intensifying heartburn and leading to nighttime episodes of choking and chest pain. To avoid these harmful effects, individuals with chronic stomach conditions are advised to eat only cooked onions, steamed, boiled, or baked. These methods soften the active compounds, making them less aggressive and significantly reducing their irritating impact on the stomach lining. Mistake 5. Eating large amounts of onions when dealing with circulation problems. Onions are often praised as a natural remedy for supporting blood vessel health. Their active compounds, such as quercetin and sulfur-containing substances, do help reduce blood viscosity, which can lower the risk of clot formation. However, what is beneficial in small amounts can become dangerous in larger quantities. For individuals who are already taking anticoagulant medications, such as warfarin, aspirin, or clopidogrel, eating large amounts of onions can significantly enhance the blood-thinning effect of these drugs. As a result, the blood may become too thin, and even a minor injury to a blood vessel could lead to internal bleeding. The danger is that these types of bleeding events often occur silently inside the stomach, intestines, or even the brain. Early symptoms can be very subtle, like fatigue, dizziness, or mild nausea. But in more serious cases, this can lead to severe outcomes, including hemorrhagic stroke or sudden loss of consciousness due to internal blood loss. The risk is especially high for older adults, as the walls of their blood vessels tend to become thinner and more fragile with age. That is why people with circulation disorders or those taking blood-thinning medications should always talk to their doctor about how much onion is safe to include in their diet. In some cases, it may be best to completely avoid raw onions or limit them to small, safe portions. Mistake 6. Eating too much onion when dealing with liver disease. Onions are well known for their detoxifying properties. They stimulate liver function and help the body eliminate toxins. However, for people with liver damage, such as cirrhosis, fatty liver disease, or viral hepatitis, onions can become more of a burden than a benefit. Onions are rich in sulfur-containing compounds, which require the liver to work actively to process and neutralize them. When the liver is already weakened by illness, its capacity is limited. An excessive intake of these compounds can overload the body's detox systems, increase inflammation, disrupt the liver's cellular metabolism, and worsen overall liver function. In real life, this may show up as increased fatigue, yellowing of the skin, dark-colored urine, or pain and heaviness on the right side under the rib cage. In more serious cases, it can trigger flare-ups of chronic liver disease that require hospitalization. To avoid further complications, people with liver conditions should eat onions only in limited amounts, no more than 30 to 50 grams per day, and only after they have been cooked. Raw onions should be completely avoided, as they stimulate the liver more intensely than cooked ones. Mistake 7. Eating onions when living with chronic kidney failure. Onions are often seen as a harmless food, but for people with kidney disease, they can pose a serious hidden threat. The issue lies in the fact that onions are rich in potassium, a vital mineral that normally helps maintain muscle and heart function. However, in cases of chronic kidney failure, the kidneys lose their ability to effectively remove excess potassium from the body. As a result, potassium starts to build up in the blood, leading to a condition known as hyperkalemia. This is a very dangerous imbalance because too much potassium interferes with the electrical signals in the heart. It can cause arrhythmias, weakness, numbness in the limbs, and in severe cases, even sudden cardiac arrest. One of the most troubling aspects of hyperkalemia is that it often develops silently at first. A person might feel only mildly unwell and not think much of it, all while potassium levels in the blood are quickly rising to dangerous levels. Raw onions, in particular, can significantly increase potassium intake. For people with chronic kidney failure, even a seemingly small serving of onion salad or an onion side dish can carry serious risks. Doctors urge kidney patients to monitor their diets carefully. Onions should only be consumed in very limited amounts and only after discussing it with a doctor or dietitian. In some cases, it may be best to remove onions from the diet entirely and replace them with foods that contain lower levels of potassium. Mistake 8. Eating large amounts of onions when dealing with heart problems. Onions are well known for their ability to boost circulation and stimulate metabolism. However, this very property can become dangerous for people with heart conditions. For someone living with heart failure, a history of heart attack, or arrhythmia, consuming a large amount of onions can put extra strain on the cardiovascular system. The active compounds in onions dilate blood vessels, speed up blood flow, and increase the workload on the heart, forcing it to beat faster and work harder. For a weakened heart, this added pressure can be overwhelming. The increased heart rate raises the heart's demand for oxygen, and a damaged heart may not be able to meet that need. As a result, there may be more frequent episodes of angina, shortness of breath, or chest pain. In more serious cases, it can lead to a heart attack or a worsening of heart failure. Raw onions are especially risky because they contain the highest concentration of active substances. The danger lies in how sudden the deterioration can occur, even after eating something that seemed harmless. That is why doctors strongly advise people with heart conditions to be extremely cautious with onions. If needed, they should reduce the amount they consume to a minimum and choose gentler preparations like steamed, boiled, or baked onions instead. Mistake 9. Eating large amounts of onions during acute inflammatory conditions. Onions are known for their invigorating properties. They speed up metabolism, stimulate blood circulation, and enhance immune function. That is why they are often referred to as a natural healer. However, during acute inflammation in the body, these effects can actually become harmful. When an active inflammatory process is already present, such as a serious infection, a flare-up of arthritis like bronchitis or pancreatitis, eating too much onion can make the condition worse. The active compounds in onions increase blood flow to the inflamed area, stimulate the production of inflammatory mediators, and boost metabolic activity in tissues that are already damaged. In practice, this can lead to more intense inflammation, increased pain, swelling, and a higher body temperature. Instead of supporting recovery, the body ends up under even greater stress. The inflammation becomes more aggressive, tissues may deteriorate more rapidly, and the person's overall condition can worsen. This is especially dangerous in cases of pancreatitis and arthritis flare-ups. In pancreatitis, onions stimulate the pancreas precisely when it needs rest and minimal workload. In arthritis or bronchitis, onions may intensify inflammation in the joints or airways, making the illness more severe and harder to treat. For these reasons, doctors strongly recommend avoiding large amounts of onions, especially raw onions, during any acute inflammatory process. When the body is fighting inflammation, it needs gentle support, not additional stimulation. Mistake 10. Improper storage of chopped onions. Very few people realize that a simple chopped onion left out on the kitchen counter can become extremely dangerous. Once an onion is cut, its protective outer layer is broken, and the vegetable becomes an ideal breeding ground for bacteria. Harmful pathogens like Salmonella and E. coli thrive especially well on the exposed surface. If chopped onion is left at room temperature for an extended period, particularly in warm weather, the number of dangerous bacteria on its surface can grow rapidly. Within just a few hours, it can turn into a serious source of infection. What makes this situation even more dangerous is that contaminated onion may look completely normal. No changes in color, smell, or texture. A person might unknowingly add it to a salad, appetizer, or main dish. A few hours later, symptoms of severe food poisoning may appear, such as sharp abdominal pain, vomiting, diarrhea, and a high fever. These types of infections are especially hard on children, older adults, and people with weakened immune systems. For them, what starts as food poisoning can quickly develop into serious intoxication that requires hospitalization. To avoid this hidden danger, it is essential to follow one simple but important rule. Once an onion has been chopped, it must be stored in a tightly sealed container in the refrigerator at a temperature no higher than 4 degrees Celsius, 39.2 degrees Fahrenheit. It should be used within 24 hours. If more time has passed, the chopped onion should be thrown away without hesitation. Next, I recommend checking out these videos, and don't forget to leave your likes and comments. I'm looking forward to them.